Ever feel like you're doing all the right things and still wondering why your body feels off? You eat well, you train hard, your labs say you're fine, but deep down you know something's slipping. You're not alone and you're not crazy. I'm Daniel Rasmussen, founder of Echelon Center for Longevity, and I've spent 2 decades helping high performers like you to reverse aging, reignite vitality, and finally get answers. On Unbreakable Vitality, we go upstream. We talk peptides, stem cells, precision diagnostic testing, reversing the age of your arteries, all the innovative science-based tools to take back your health span so that your next decades are your best yet. Because aging is real, but decline is optional.
Welcome back to Unbreakable Vitality. Today's episode is one I've been waiting to dig into because it's something that affects almost every one of us. Even if you've never been diagnosed, even if you feel fine, and especially if you're over 40 and you're wondering why your brain is foggy, why your belly feels bloated, why your energy has been hijacked by what exactly? We're talking about inflammation. And it's not the kind you see when you twist your ankle or scrape your knee. I'm talking about chronic low-grade systemic inflammation, the slow burning, silent arsonist inside your body. It's the kind of inflammation that quietly rages and ages you from the inside out. It messes with your memory, gums up your metabolism, it stiffens your arteries, disrupts your hormones, and it just makes you feel like you're living life in a fog, all while your doctor looks at your labs and says, "You're fine, good job." But you and I both know it doesn't feel like this. So in today's episode, I'm going to walk you through what inflammation really is and what it's not, how it hides behind symptoms like fatigue, brain fog, and stubborn fat, the labs we run at our clinic to detect it before it becomes disease, and what actually reverses it. No, turmeric alone won't cut it. And yes, we'll laugh a little too, because if we're going to confront the root cause of modern aging and decline, we might as well have a little fun along the way. So grab your glass of anti-inflammatory lemon water or your coffee, not judging, and let's dive in. This episode of Unbreakable Vitality, Inflammation Nation, how to find it, fix it, and reverse its impact on aging. So let's talk first about what inflammation really is. Let's set the record straight. Inflammation isn't always the bad guy. In fact, when your body gets hurt, like when you stub your toe or cut your finger, inflammation is the first responder. It shows up, cleans up the mess, starts repairs, and then it quietly exits stage left when the job is done. That's acute inflammation. And that's a good thing. But chronic inflammation, that's a moody roommate who never moves out. It lingers, drains your energy, eats your snacks, slowly trashes the place. It's silent, it's sneaky, and it's one of the most overlooked drivers of accelerated aging and disease and fatigue. Most of the time you don't even feel it. It's not painful like a swollen ankle. It's subtle, like the brain fog you chalk up to aging, the belly fat that refuses to budge no matter how clean you eat, the stiffness in your joints that wasn't there a few years ago. That's chronic inflammation talking. We call it inflammaging. And the worst part, it often doesn't show up on standard lab tests. Your doctor looks at your numbers and shrugs. Everything is normal. Meanwhile, your mitochondria are gasping for air and your vascular system is putting out fires left and right. That's because the traditional model of testing is designed to catch full-blown disease, not dysfunction. It's like waiting for the house to burn down before checking if the smoke alarm works. At our clinic here in Seattle, we don't wait. We test for signs that inflammation is already disrupting your body's systems long before you hit a diagnosis code. Because by the time chronic inflammation shows up as a heart attack, autoimmune disorder, or neurodegeneration, the damage is deep and it's sometimes irreversible. And often it's too late. Coming up in the next segment that I want to talk about is how this sneaky fire shows up in your everyday life, and how to spot the symptoms, and even when your labs say you're fine, what to do about it. So symptoms, okay? Not the dramatic ones, but the ones you've probably learned to just deal with and push through. You wake up tired even after a full night's sleep. You just get used to it. Your brain feels like it's buffering. You eat clean and you work out and you still can't shake that extra 10 pounds around your midsection. You're more irritable. less focused, and your joints creak like an old floorboard. Sound familiar? These are classic signs of chronic low-grade inflammation, the kind that flies under the radar of conventional labs, but it leaves a trail of destruction in your body. You don't need a diagnosis to know something's off. Fatigue that doesn't improve, brain fog that's not just aging, workouts that wipe you out for 2 days. Inflammation is often the common thread in all this, silently affecting how your body regulates energy, repairs tissue, and responds to stress even. So the way we look at it, we see this all the time. And here's the kicker. Most of our patients have been told that they're fine, so they're misled by their healthcare providers. Their cholesterol is okay, their A1C is borderline, their CRP might not even be tested. But when we dig deeper, the truth shows up and the blood doesn't lie, because you don't fix what you don't test. What doesn't get measured doesn't improve. And you don't test what you don't suspect also. So let me be clear. If you feel inflamed is real. It's not just up here in your head. So I want to share the exact labs that we run that actually uncover what's hiding. So you can stop guessing, start measuring, and take action before that fire spreads. Let's pull back the curtain on how we test for inflammation the correct way, because most primary care panels are like reading the headlines and thinking you've read the whole book. So here are the tests we run at our center that go way beyond the standard. And here's why they matter as well. HS-CRP, high sensitivity C-reactive protein, is not your average CRP. This one catches the low-grade smoldering fire that burns under the surface. If it's even mildly elevated, your risk of heart disease and cognitive decline jumps dramatically. Another marker, homocysteine. Homocysteine is a metabolic troublemaker. High levels increase vascular damage and oxidative stress. It also messes with your methylation. That's the process that controls detoxification, brain function, and genetic expression. So if you want to monkey with those mechanisms, go for it. But homocysteine is easy to measure, not so easy to correct, but there are ways to get it down. Next, MMP9 and IL-6. These are like the messengers that yell, we've got damage, tissue damage. And if they're high, it tells us your body's tissues, especially the vascular system. Think your arteries in your carotid arteries and coronary arteries and brain arteries. They're inflamed and being destroyed in real time. You want to know if you have those markers, MMP9 and IL-6, interleukin 6. Oxidized LDL is another one. Forget basic cholesterol. Your cholesterol numbers have nothing to do with your risk. Oxidized LDL test shows whether your LDL particles are rusting from the inside out. And it's one of the best predictors of future plaque formation, because those are the ones that get trapped in the little tight junctions that are breaking down leaky vessels. You've heard of leaky gut. You can have leaky vessels. That's where cholesterol oxidizes, gets trapped, and starts forming plaque. Next one is looking at your fasting insulin and your triglycerides. If you have elevated insulin and normal glucose, is a neon sign for metabolic inflammation. And if your triglycerides are high while your HDL is low, that's not just bad, that is a biochemical red flag and a ticking time bomb for a silent killer. It's like flipping the high beams on your car on an otherwise completely dark road, and all of a sudden you can see that you are headed straight off the curve. These markers help us connect the dots between how you feel and what's happening biologically in your body. So when we repeat them over time, we can track the progress like a health GPS. We can start seeing, hey, we're going to actually make this curve, and we might skid a little bit, but we're going to make it. I want to also show you what really moves the needle on inflammation. And no, it's not just another anti-inflammatory peptide or supplement stack. What really reverses inflammation is way beyond just turmeric. Turmeric's great, don't get me wrong. But what actually works? Well, let's talk about turmeric. Turmeric is nice. Also, fish oil can be helpful. Reversing chronic inflammation isn't about throwing every anti-inflammatory supplement in your Amazon cart. So It's about building a strategy that supports your body's detoxification system, the drainage system. It resets your metabolism and it turns down the inflammatory dial at its core, at its source. So here's what we focus on. Open those drainage pathways. If your liver, your kidneys, and the lymph are all sluggish, inflammation gets recycled, not released. It just gets stirred around. Think of it like a sink full of dirty water with the drain plugged. We then use bitters, binders, and hydration strategies to clear the exits. Then you've got to stabilize blood sugar. Inflammation spikes often begin with glucose spikes. You don't need keto, just stable. Prioritize protein, avoid naked carbs, and take a walk after meals. Simple, but it works. Next thing you got to do is you got to regulate your cortisol. You can't be inflamed and in flow at the same time. You've got to support your adrenal function first through testing, salivary adrenal function testing, looking at that hypothalamus pituitary adrenal axis, and looking at basing peptide therapy, adaptogens, and restoring circadian alignment through lifestyle architecture, because stress is a gasoline on the inflammation fire. Also, with stress, you can't escape it. The only thing that can change is how you respond to it. So you've got to change how you handle stress in your life. Next, rebuild the mitochondria function. These are your little energy engines. And inflammation clogs those fuel lines. We use NAD, CoQ10, MOTS-C, mitochondrial IVs. To get those engines running clean again, you've got to repair and get the mitochondria functioning right. 5, heal the gut. If your gut is leaky, everything leaks. We test GI markers, and I don't mean leaking out your belly, right? When you take a sip of water, you're leaking out your belly. That's not leaky gut. That's something else. Leaky gut is leaking into the systemic blood circulation. So we test GI markers, we repair the mucosa, we reduce the immune triggers in the gut, secretory IgA, zonulin, then we restore a resilient microbiome. It's not a one size fits all. It's all based on your personalized testing. So then now we can layer on the GPF method, the stem cells, the regenerative medicine, peptides, personalized protocols, all in the correct sequence. We got to get your body prepared to rebuild and regenerate before you can stimulate those signals. Because the real healing doesn't come from another pill or a one and done cleanse. It comes from strategy. And when we use the right data, those results will follow. And it's moving the needle. So we're talking about how inflammation accelerates aging and what you can do right now to start reversing that trend. And the aging link, inflammaging, cognition, and disease risk, they're all tied together. So let's talk about how inflammation doesn't just make you feel older, it actually ages you at the cellular level. And we've got the research, the labs, and the real world results to prove it. Inflammaging, yes, that's a real term. Didn't just make that up. It's what happens when chronic inflammation slowly accelerates biological aging. It's not loud. It doesn't make a dramatic entrance. It sneaks in, sets up camp, and starts sabotaging systems from behind the scenes. First, it wrecks your mitochondria, the power plants of your cells. You lose energy, not because you're lazy or getting old, but because your cells literally can't make enough fuel. They're inflamed and underperforming. Imagine trying to drive cross country with a gas tank full of maple syrup. Not good. Next, it shortens your telomeres. Those protective caps at the ends of your DNA, well, they get shorter and shorter, and your cells get older and older. It's like a biological clock. Starts hitting fast forward without your permission. Then there's the brain. Inflammation shrinks memory regions, disrupts neurotransmitters, and slows processing speed. You might forget names more often or walk into a room and forget why you're there. That's not just midlife, that's neuroinflammation doing its thing. Don't ignore that. Finally, it's your hormones too. Inflammation throws your entire endocrine system into chaos. Cortisol spikes, insulin resistance kicks in, thyroid slows down, testosterone drops, estrogen gets wonky. Suddenly you're more tired, more puffy, more moody, you're gaining weight and wondering if you're falling apart. Well, you're not. You're just inflamed. And the good news, we can reverse it. At our center here in Seattle, we've seen clients drop their biological age by 5, 10, even 15 years once we address the inflammation head on. You're going to sleep better. You're going to think clearer. You're going to move stronger. You stop managing decline and start building vitality. So if you felt the slow creep of aging, or like your get up and go, got up and went, this is your wake-up call. Inflammation might be behind it, and you can change the trajectory. Up next, I'm going to share where to go to grab our free lab guide so you can stop guessing, start testing, and finally feel like yourself again. Get the biomarker blueprint for energy, longevity, and vascular health. If you're ready to uncover hidden inflammation, decode your blood work, and learn exactly which labs predict your long-term vitality, download our free guide. It's the biomarker blueprint for energy, longevity, and vascular health. Visit echelon-longevity.com/longevity-blood-labs to get instant access. You're going to learn the blood tests that we run that most doctors miss, how to read inflammation before it becomes a disease, and how to use data to reverse aging from the inside out. Because longevity doesn't start with guessing, it starts with the right labs. So next time on Unbreakable Vitality, we'll talk about the most misunderstood molecule in medicine, which is cholesterol. And I hinted at that at the beginning of this episode, but we're going to talk about why lowering it blindly is a big mistake, and how to use advanced lipid testing to reveal the real cardiovascular risk. I'll see you then.
If you're feeling like your energy, your edge, or your clarity just isn't what it used to be, you're not alone. But you're also not stuck. Every week on Unbreakable Vitality, we explore real strategies to reverse aging, reclaim vitality, and rewrite what's possible. If today's episode gave you even one insight, pass it on. Then go take the free vascular age quiz at echelon-longevity.com/quiz to see how your body's aging. Subscribe, leave a review, and follow us, because your future isn't on autopilot. You are building it, and you're just getting started.